All right, so hard to think I'm talking about my last final reflection at the Kent School, but here we are. So, first thing the paper asked us to discuss was theories, research, and practice around a social problem we were interested in. So, first of all, thinking through the social problem I'm interested in and populations I want to work with, I really have a lot of interest in working with patients and their families who are at end of life or are experiencing life limiting illness. So, cancer, um, Parkinson's disease, which is becoming more and more of a concern, chronic heart failure, just any of these kinds of things where people truly are at end of life or very near end of life, and working with them as we make plans for what that experience will be. This is something that is, I guess, hard to think about in terms of research because there's not a lot of it there. Most everything around the research is anecdotal because most of the time research is, you know, behind the times in a lot of ways. So everything we were getting was coming from people's families and very little from patients themselves. So there's not a lot of research to support best practice. A lot of that is what the families are telling us was important to them. But thinking about the theories, there were two theories that really strike me. One is rational choice, and the other is systems. So, rational choice theory, I think, is probably the most important because it assumes that everyone is making a rational choice, has evaluated the costs and benefits, and knows exactly what that analysis looked like to them. We do this a lot with patients when we're talking about end of life. So, do we continue treatment or are we going to stop treatment? Do we want CPR if our heart stops beating, or do we want to be permitted to die naturally? Um, those kinds of things and letting people weigh those out is important in what we do, and I think people are thinking about a rational choice. The other theory that's important is systems theory because all of those decisions that we're making regarding end of life or how we want our end days to be are considerate of family, they're considerate of our friends, they're considerate of whoever else might be in our life and playing a role. So even if it's functioning as one big system or a bunch of small micro systems, it is still that system's in place. Thinking about the advocacy project I did this semester, mine actually did not pertain to this population. Um, the state representative in the district I live is very, very engaged in the community. She lives just a street over from me, um, but she has a lot of meet and greets, and she's constantly walking around talking to people. And I had a chance to meet her at one of her events a little bit more and talk with her about what was in Kentucky as House Bill 1, which was a foster care kind of overhaul of the system. So, being a foster parent, I had time to sit down with the representative and talk through some things that were in that bill that I knew was coming out. Overall, everything in it was fairly positive, but some of the things that had initially been presented were not. Um, when I first heard them start talking about this bill back in the fall, one of the things that the governor was really pushing for was to move foster care out of the state system. He didn't feel the state had an obligation to provide for these kids. Rather, he often was sought or found to be quoting a Bible verse that said the church was responsible for widows and orphans. And he really had this feeling that this was the church's responsibility. This was not something the state should be involved in. And he had broke this down that if every church in the state of Kentucky would say we'll be responsible for 2 kids in foster care, that would move everyone out of foster care, that would put them in these good homes, and we all know, these are his words, that when these kids find Jesus, all their problems will go away. I have some disagreement with that for multiple reasons, but what I was more often hearing him say without saying it was, I don't want these kids going to homes where they're going to be raised by 2 men or 2 women or those heathens who don't go to church. I need to be sure we're putting them in homes with 1 man, 1 woman, and they will be able to thrive in a Christian environment. So those were kind of things I was trying to alert the representative to and say, think about the impact this could have, for not only the families, but the kids who are with families who have 2 dads or 2 moms. And what does that look like when you pull them out of this environment? And I know the governor's going to argue that, well, the hellacious experience they're in, having 2 mothers, can't be, comparable to the trauma that will be able to be healed from moving to a new family, but trying to put those ideas out there. She was appreciative of that information. I think, what I do know of her, she would have had concern about that, but being able to voice that and let her hear it from her constituents, I think really was important. The one big idea I have is a single-payer healthcare system. I feel like I'm on a Bernie Sanders train every time I talk about this, but we are the only industrialized nation that has a for-profit healthcare system, and it's just wrong. When we look at the things that can be accomplished in single-payer systems, not only in terms of quality of care, but the affordability of care, and how people thrive in those environments compared to what we offer, I really think we're going to have to at some point take a hard look at that, and that involves some education. Particularly in rural communities, I think people sometimes vote not in their best economic interests, rather they vote with their religious and spiritual beliefs, and that tends to, I think, sometimes push conservative values. So sometimes rural communities and low-income families will support the pro-life, anti-gay marriage movement versus economic flexibility and the thinking about what they could have. Thinking about my entire time at Kent School was really hard. The last 3 years have been life-changing for me in terms of how I view people and the world I live in, and kind of trying to think about things from a different lens really has been important to me. This idea of appreciative inquiry and helping people not to be helped in a way we think they need, but really finding out, what do you need? What is your community needs? And what is your personal needs? So thinking about those macro level experiences and how we really can make micro level changes just by making macro level community changes. And the simple things that, putting in a playground does for kids in a community. And starting to think through some of those kinds of things has really been important to me. But I think the thing that I've most appreciated and most benefited from, and really something I will take forward, is the connections I've made with people. So the connections I've made with faculty, not only in Louisville, but faculty I've had all over the country who are teaching courses in the Kent School, and how I can use them as a resource, but also how I can use you all we've been in classes with as resources. A lot of us have done several courses together, and we've spent, lots of time writing papers and discussing things, and just having those resource bases really will be something I carry into the professional world. So we are shortly there. Congratulations to everyone who's graduating, and I look forward to entering the professional world with you in just a few short weeks.